Now, the next chapter is Physiology of Hematology and Oncology. Hemoglobin electrophoresis. Hemoglobin electrophoresis is a laboratory technique used to separate different types of hemoglobin based on their electrical charge. During gel electrophoresis, hemoglobin molecules migrate from the negatively charged cathode to the positively charged anode. Among the common hemoglobins, hemoglobin A migrates the farthest, followed by hemoglobin F, then hemoglobin S, and finally hemoglobin C. Why does this happen? Because of missense mutations in hemoglobin S and hemoglobin C. In hemoglobin S, glutamic acid, which is negatively charged, is replaced with valine, which is neutral. In hemoglobin C, glutamic acid is replaced with lysine, which is positively charged. As a result, hemoglobin C and hemoglobin S are more positively charged than hemoglobin A, so they do not migrate as far. Mnemonic. A fat Santa Claus can't go far. HBC is closest to the cathode. HBA is closest to the anode. Antiglobulin test, also called the Coombs test. The antiglobulin test detects antibodies against red blood cells. There are two types, the direct Coombs test and the indirect Coombs test. 1. Direct Coombs test. Here, the patient's red blood cells are mixed with anti-human globulin, also called Coombs reagent. If the patient's red blood cells are already coated with antibodies, they will agglutinate. This test is used in the diagnosis of autoimmune hemolytic anemia, abbreviated AIHA. So if agglutination occurs, the direct test is positive and indicates that anti-red blood cell antibodies are present. If no agglutination occurs, the test is negative. 2. Indirect Coombs test. Here, normal donor red blood cells are added to the patient's serum. If the serum contains antibodies against red blood cells, those antibodies will bind to the donor cells. When Coombs reagent is added, agglutination occurs if antibodies are present. This test is not used for AIHA. Instead, it is mainly used for pre-transfusion testing to check if the recipient has antibodies that could react against donor red blood cells.